Last night, economics correspondent Paul Salmon reported on the impact in Massachusetts after a private equity firm bought several struggling hospitals there. Tonight, Paul looks at the bigger picture, the effect of private equity investments on Americans' health care.
There's a bereavement box, and some items are placed with the baby.
Nurse Ellen McInnes.
And the baby's remains, and that eventually goes to the morgue.
She's talking about what happened at her hospital after purchase by a private equity firm, Cerberus, which created a subsidiary, Steward Healthcare, to run 8 struggling Massachusetts hospitals.
Stewart didn't have any bereavement boxes. They didn't pay the vendor, so there weren't any. So nurses were having to put babies' remains in bankers' boxes and cardboard shipping boxes. It only happened once or twice, and then nurses went out and bought the bereavement boxes themselves.
Plus, 15 deaths were attributed to the care, or lack of it, in the hospitals, 2 now completely shut in the wake of the private equity purchase. Moreover, it wasn't just in Massachusetts. Steward bought 37 hospitals around the country, and more than 450 hospitals nationwide have been taken over by private equity, as well as nursing homes, emergency rooms, doctors' practices, and air ambulances. One analysis finds that private equity investors spent more than $200 billion on healthcare acquisitions in 2021 alone, and $1 trillion over the past decade.
It's a real problem.
And that problem, says Cindy Friedman,
Private equity is a complete opposite of the delivery of health care.
State Senator Friedman has been trying to rein in private equity in Massachusetts through legislation.
Make money, leave, make it however you want, make it for people who are invested in making money. And then you've got healthcare, which is all about delivering care to people. The cost is not the first thing. The delivery of care is the first thing. And those two things do not mesh.
But they are now joined at the hip, says economist Rosemary Bott.
We're seeing a rise in financialization and the role of unregulated financial actors in Main Street companies because of the deregulation of the financial industry that took place over decades.
And thus privatization, a lot of it by private equity.
This has happened in many industries, but it is particularly serious when it has moved into social goods such as healthcare, where people's lives are at stake.
So, an economic disaster, really?
It was a struggling hospital system.
Economist Ryan McDevitt, who's presented his work at private equity events, says healthcare in general and the Steward hospitals in particular were failing long before private equity got involved.
They were poorly performing. Private equity tried to salvage it, didn't quite work. But I wouldn't say that's specific to private equity.
As usual, private equity promised to invest to improve its purchases.
Healthcare is dysfunctional, it's broken, there's a lot of waste in the system. If private equity can come in, reduce costs, increase profits, that should be a good thing.
Should be, but is it? Before I try to answer, here's a shot at explaining what private equity is. First, private, because as with so-called hedge funds, there are few enough investors that the SEC doesn't regulate private equity firms. What investors?
Well-known entities in our society, including pension funds, institutional endowments, as well as wealthy individuals.
MD Zuri Song of Harvard Medical School studies the industry. He notes that most of the purchase price of a hospital or other healthcare entity is provided by debt owed to the lender, like a bank. That debt and the interest on it is then paid by the hospital or medical practice. When this model first came in the 1980s, the idea was that it was the discipline of debt, force the acquired company to become more efficient, no?
Indeed, and not only that, it's also the addition of managerial expertise that private equity firms bring in to healthcare settings that may have lacked it.
But as with hedge funds, private equity's main appeal to investors is the industry's outsized return rate, estimated at 13% a year for the past 25 years. By comparison, the stock market, as measured by the S&P 500, 8.6% a year. Now, debt and expertise might result in more efficiency and profits, but so might cutting corners, supplies, staff. and using a tactic at the heart of almost every hospital buyout, selling off the real estate. Again, economist Bott.
The private equity firm can buy out a hospital, quickly divide it into a property company and an operating company, sell off the property for millions, and immediately turn that into cash, which it gives back to itself and to its investors. The hospitals are left not only with the debt from the buyout, but with these high rents that increase every year.
So now the key question, the results of private equity in healthcare. Well, Dr. Song and Associates have studied Medicare data of more than 500,000 patients in hospitals after private equity takeovers. Their findings?
On average, across the country, private equity acquisitions of hospitals have led to a roughly 25% increase in patient adverse events.
Really? Like what?
This was driven by an increase in central line associated bloodstream infections and an increase in patient falls, as well as a doubling, roughly, of surgical site infections relative to a control group or comparison group of hospitals that looked like the private equity hospitals but were not acquired by private equity firms.
Meanwhile, in the Steward buyouts, CEO Ralph De La Torre himself took out at least $250 million, according to a Wall Street Journal investigation. Cerberus, the initial private equity buyer, blames De La Torre, but it earned $800 million in profit on a $246 million investment when it sold its stake 11 years after purchase. So isn't this an overall indictment of private equity's involvement in healthcare?
Absolutely, these anecdotes are concerning.
Again, researcher Ryan McDevitt of Duke.
But what I'm trying to convey as an economist and academic is that we have to move beyond these anecdotes. Is this happening systematically because of private equity? I don't think that's clear at all. What stood out to me is in that same study, what was buried was that death rates actually fell more than the adverse events went up.
He's referring to Dr. Song's study. But reading it, the death rates only fell for the first 30 days, not after. And crucially, Song's study compared private equity hospitals to random equivalents. The outcomes at the private equity hospitals were noticeably worse. Dr. Song's takeaway?
Although it remains true that in certain instances, private equity financing can turn around a struggling healthcare provider, to date, on average, that is an exception rather than the rule.
And that would jibe with the complaint we heard time and again. As nurse Ellen McInnes put it,
It has to do with what happens to the money, whether it goes to an account in the Caymans or it goes into Ralphie De La Torre's pocket. It doesn't matter. The money that should be there to take care of these patients is not.
not much of the time, it would seem. For the PBS NewsHour, Paul Salman.